Okay, you can see the screen now. Hello. Can you see the screen properly? You can zoom in. Okay, it will take some time to make it clear that it will be. Okay, sorry. Okay, we have seen this, but just very rapid revision. Vertebral artery. This is a branch of vertebral artery is a branch of vertebral artery is a branch of subclavian artery. As like we studied vitamin C and D. So vitamin B is for vertebral artery and it has mainly four parts. First part, second part, third part, and fourth part. Just have a look. First part, this is vertebral artery arising from where? Subclavian artery. Yeah. From here it is arising, then it is growing and it is entering into C6 vertebra. Foramen, transverse foramen. See, from here it is going up and it is entering into the vertebral foramen of cervical 6. This is 5, then it is 6. This is cervical 6 vertebra. Then it is going up, it is ascending and reaching up to C2. This is C2. The name of the C2 vertebra is, first one is called Atlas. C1 is called Atlas. Number 2 is Axis. Number 2 is Axis. Yeah. So when it is reaching up to the axis, then it is going laterally. If we see here this part, so it is going laterally from here. See, from here it is going laterally, vertically. When it reach at the lateral surface of the C1, see at this level, it again go medially, and in both sides, it passes. I mean, it crosses the C1 vertebra in both sides, then it goes medially. In both sides, when it goes medially, it enters into the base of the skull, from the back. It ascends up, and at the level of pons, they join together to form this. This is called basilar artery. Basilar artery again they divide it to two: posterior cerebral artery, and yeah, and then they form circular fields. Common carotid artery, mainly they bifurcate at the level of border of C3. Okay, lower border of C3, lower border of C3. Okay, lower border of C3 at this level and in between C4. So this is common carotid artery bifurcate into external and internal carotid artery at the level of C3. Okay, internal carotid artery, this one. Internal carotid artery, we need to know their branches. Internal carotid artery enter into the skull through which foramen? Carotid, yeah, carotid foramen. So after entering into the skull, they give their first branch, that is ophthalmic artery. So don't forget ophthalmic artery. Ophthalmic artery is the first branch of internal carotid artery. Okay, and they have other branches also like posterior communicating artery, choroidal artery, anterior cerebral artery, and middle cerebral artery. See here, this is internal carotid artery. They are giving their first these branches, everything. So ophthalmic artery, then it is giving uh, anterior cerebral artery, medial cerebral artery, posterior communicating artery, and this is the choroidal artery. In MCQ, they give option which of the following branch of the internal carotid artery don't take part in circle of wheels. In circle of wheels. Okay. So in circle of wheels will not take part mainly ophthalmic artery. Okay, good. Mm-hmm. Yeah, yeah. Okay, no problem. So before pattern was there, if you just solve the recall, uh, question used to come from there, but now it is different. Now have to read in details. Okay, so have a look. Again, this is internal carotid artery coming, giving their first branch ophthalmic artery, then one branch going anteriorly. This is anterior cerebral artery. One branch going in the middle. This is middle cerebral artery. One branch giving here like choroidal artery and ophthalmic artery, and one branch posteriorly. This is posterior communicating artery. Posterior communicating artery again joining with the posterior cerebral artery, and posterior cerebral artery is the branch of basilar arteries. So this is internal carotid artery. Internal carotid artery don't give any branch in the neck region. Okay, internal carotid artery will not give any branch in mm, in the neck region. They will not give any in the neck, in the neck, in the neck. Mm. Mm. Yeah, they will not give any branch in the neck. Okay. Now, The internal carotid artery does not have any branches in the neck. This is MCQ. Also, nerve at risk during carotid end arterectomy. Okay, yeah, nerves at risk during carotid end arterectomy. Those are hypoglossal nerve and vagus nerve. You remember tongue? What was the nerve supply of the tongue? 5, 7, 9, 12. Yeah. Okay. Okay. So if we do any carotid end arterectomy, this number 10 and 12, yes, I can. 10 and 12 are at risk. Also, greater auricular and superior laryngeal. Okay. External carotid artery. So from internal carotid artery, mainly we need to know what are their branches. Keep in mind from vertebral artery from both side vertebral artery when they join together to form basilar artery. Just before joining, they see one joining, they are joining anteriorly. There will be another joining posteriorly. This posterior joining actually through their small branches, and this is forming anterior spinal artery, and they are forming anterior spinal artery. Okay. Okay. So this part also done. External carotid artery, very important. External carotid artery, we need to know their branches. Some branch come in the front, I mean anteriorly. Some branch will go posteriorly, and some branch will go deep. Okay. So the anterior branches are superior thyroid artery. Before also we have seen superior thyroid artery. Thyroid has to how many blood supply? Mhm. So thyroid has superior thyroid artery, and I told that from now try to make it as like a habit. Whenever you say any branch of the blood vessel, try to say their origin. I mean from which branch it is coming. So superior thyroid artery, if you say superior thyroid artery, so it is branch of external carotid artery. Inferior thyroid artery, branch of inferior thyroid artery will be branch of thyrocervical trunk. Thyrocervical trunk is the branch of subclavian artery. Subclavian artery is the branch of subclavian artery is the branch of. Then you have to say in the right side it is coming. In the right side it is coming from brachiocephalic branch, arch of aorta. Okay. So in the front, just it is very simple. In the front, they are giving superior thyroid artery, lingual artery, and facial artery. In the behind or posteriorly, they are giving occipital and posterior auricular and deep ascending pharyngeal. Again, you can see this is common carotid artery at the level of C3, lower border of C3 or C4. It is dividing into external and internal carotid artery. Okay, so this is internal carotid artery. Internal carotid artery will go up, 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 and then it will enter into the skull through the carotid foramen. And external carotid artery, see here, first it is giving a branch, and it is giving a branch anteriorly. And this is the branch of superior, because here is the thyroid gland, it is giving supply to the thyroid gland. So it is superior thyroid artery. First branch, and it is giving anteriorly. Again, it is going little up, giving another branch, and it is giving, its name is lingual artery, because this artery is going to supply in the tongue. Okay, and little going up, again giving another supply, and it is giving supply to the face. So facial artery, lingual artery, and superior thyroid artery, they all are in the front or the anterior branch, right? Three branch: superior thyroid artery, facial artery, lingual artery. Now in the back, here is the ear or the auricle. It is, see, it is giving one branch in the back. It is going in the occipital region. So this is occipital artery in the back. It is giving one branch in the back, occipital artery. Yeah, posterior, and one branch going behind the ear. This is posterior auricular artery. So in the behind, it has two branches. One is occipital artery and posterior auricular artery. Then, then external carotid artery, terminating into two branches. They are terminating. I mean, external carotid artery will finish by dividing into two arteries. One is axillary artery. Yeah, one is deep. Deep is ascending pharyngeal artery. It is near the pharynx. Here, we cannot see this one. It will be ascending pharyngeal artery. And there will be terminal branch. One is going superiorly, but superficially. This is superficial temporal artery, and another one is coming towards the maxilla. It is maxillary artery. One more very nice picture. This one you can see. Here you can see. In the front, they are giving some branches. This is superior thyroid artery, then lingual artery, facial artery, and they are terminating into maxillary artery and superficial temporal artery. And one branch going posterior behind the ear. This is posterior auricular and occipital artery, and one branch going to the deep. This is ascending pharyngeal artery. Middle meningeal artery is very important. Middle meningeal artery is the largest of all the arteries which give supply to the meninges. And middle meningeal artery, they arise from where? They arise mainly from arise from maxillary artery. Okay, from maxillary artery. Yeah, from maxillary artery. And Foramen terminal branch of external carotid. Terminal branch of external carotid. So this is external carotid. You can see they are dividing there. This is the terminal branch, and from there they will have middle meningeal artery. This is the middle meningeal artery. If there is any trauma or injury over this area, this is over the pterium, so middle meningeal artery will be injured, and patient will have uh, extradural hematoma. Say rupture of the artery may give rise to an extradural hematoma. Brachycephalic artery. Brachycephalic artery is simple. No need. It is very simple. Subclavian artery. Subclavian artery. Yes. So we know the branches: vertebral artery, internal thoracic artery, gyrocervical trunk, costocervical trunk, and dorsal scapular artery. Internal jugular vein. Jugular vein is difficult one. Venous vein is as like if you try to remember it with the arterial supply. Okay, as like common carotid dividing into external and internal carotid, right? So jugular also we expect that something uh, external jugular and internal jugular from the same, but see from here in this picture you can see this is uh, from here subclavian this is subclavian vein. From subclavian vein, one vein is directly going up as like internal jugular vein, and from here we are getting external jugular vein. Okay, and internal jugular vein, internal jugular vein. See, at the begins at the jugular foramen as a continuation of the sigmoid sinus. You remember in the foramen we studied. Mm, yes, yes, sigmoid sinus and inferior petrosal sinus, they both join together to form sigmoid sinus. Internal jugular vein. Yeah. So they end by uniting with subclavian vein to form innominate vein behind the sternum. The joining subclavian vein, we are reading about internal jugular vein. Okay, this is internal jugular vein. External external jugular vein runs obliquely in the superficial fascia of the posterior triangle. External jugular vein run in the superficial fascia of the posterior triangle. It drains into the subclavian vein. The third part, not the second part of the subclavian artery. So external jugular vein remains parallel to internal jugular vein. Now cranial nerve. Here we need to know all the cranial nerves are connected. Now, before I had a thought then. as like common carotid. Yeah, this ঠিক আছে। একদম। Cranial nerve, olfactory, optic, op Mhm. Olfactory, no need. Optic, here highlighted part need to read. Oculomotor, to remember SO4 LR6. Oculomotor is the nerve which causes movement of the eyeball. Movement of the eyeball all by the oculomotor. So remember SO4 LR6. SO4 LR6. All all see the pupillary effect okay. It supplies all ocular muscle apart from lateral rectus L LR and superior oblique. Superior oblique is SO. So SO4 means superior oblique muscle is supplied by trochlear. Number 4. Trochlear is number 4. Okay. Trigeminal is number 5. And then abducens is number 6. So six is supplied by which one? LR6. So lateral rectus muscle is supplied by abducens nerve. Superior oblique is supplied by trochlear nerve. All other muscle is supplied by oculomotor nerve. Hmm. Here the highlighted part just you can read. Facial nerve important. Hmm. Facial nerve, vestibulocochlear nerve, glosopharyngeal nerve, vagus. Cranial nerve carrying parasympathetic fiber. Which cranial nerve has the parasympathetic fiber? Parasympathetic fiber containing cranial nerves are 1973. You can remember like this 1973. So it is 9, 10, 7, and number 3. They are parasympathetic. So number 3 is oculomotor. Then number 7 is facial. Number 9 is glossopharyngeal. And then 10 is vagus. This nerve, yeah, here you can see. Number 3 is oculomotor, facial, glossopharyngeal, and vagus. they have the parasympathetic fiber. And which fiber? Like oculomotor, pupillary constriction and accommodation. Third cranial nerve, parasympathetic fiber act on pupillary muscle, and they causes pupillary constriction and accommodation. Facial nerve over the lacrimal gland, submandibular and sublingual gland. Glossopharyngeal over parotid, and vagus over the heart and abdominal viscera. You can see their location. This is olfactory bud here, like this olfactory bud. Then this is optic chiasma. Here we will have optic chiasma. So this is optic nerve number one. First is olfactory number one, then optic, olfactory. This is oculomotor, then trochlear. This is trochlear. This is trigeminal, very big one. Trigeminal is very big. You can see trigeminal, very large. In trigeminal, it has three V1, V2, V3. We have here. Then abducens. This is abducens. You can see here. Pontomedullary junction. Abducens. Then there will be facial abducens. Next to it is, this is abducens. Then next is facial. Abducens, facial. Then number 9, 10, 11, 12. All are here in the lateral space. You just read this part 2-3 times. Now, trigeminal nerve. Trigeminal, already we have seen, it has V1, V2 and V3. So, trigeminal nerve is the main sensory nerve of the head. Okay. Distribution of the trigeminal nerve sensory on the scalp. You can just read this one: sensory motor and autonomic or ganglia. Trigeminal nerve has ciliary, sphenopalatine, otic, and submandibular. Autonomic means involuntary, means autonomic. You can just remember these are special type. It is not like sensory or motor. It is special type of function, right? Trigeminal itself is a mixed nerve. They have both motor function and sensory function. Their action depends on which ganglia. If it is on submandibular, then it will regulate the secretion of the salivary gland. Okay. If it is on the ciliary muscle, it will regulate the pupillar size. Sometimes it will be constricted, quite like that. Three branches of the trigeminal nerve: ophthalmic only sensory, maxillary only sensory, but mandibular nerve has both sensory and motor. V1 means ophthalmic. It goes through the superior orbital fissure. V2 is the maxillary. It goes through rotundum. And V3 foramen ovale. This is the distribution in details. facial nerve is supplied over the face, ear, taste, and tear. Face, ear, taste, tear. Fit, F-E-T. Face, ear, taste, tear. This is the supply of the facial nerve. Over the face, it causes supply over the muscle of facial expression. Ooh, muscle of facial expression. Okay. Over the ear, Nactus stapedius. In the ear is supplied Nactus stapedius. In the taste, supplies anterior two-thirds of the tongue, and tear, parasympathetic fiber to the lacrimal gland, also salivary gland. And path, it is important. Path, origin from motor, arises from the pons, sensory, nervous intermedius. No need. Actually, it is pontomedullary junction in between pons and the medulla. Pass through the petrous temporal bone into the internal auditory meatus with the vestibulocochlear nerve. We need to remember number 7 and 8 is both nerves exit the skull through the same foramen, that is vestibulocochlear. Okay, and here they combine to become the facial. Okay, its pathway is different in the facial canal path. The canal pass superior to the vestibule of the inner ear. At the medial aspect of the middle ear, it becomes wider and continuous. In genicular ganglion, no need. Facial canal, it has three branches. In the facial canal, it has three branches. One is CNG. C is chorda tympani, which gives taste sensation. N is naphtostapedius, and G for greater petrosal nerve. Greater petrosal nerve. So see, these are the branches in the facial canal. We are reading about the facial nerve. Facial nerve. First, they give branch in the facial canal. Uh, Three branches in the facial canal: chorda tympani, naphtostapedius, and greater petrosal nerve. Stylomastoid foramen. Through the stylomastoid foramen, it comes into the face, and then it gives its typical five branch. As we know, facial nerve has five branches. That is temporal, zygomatic, buccal, uh, marginal mandibular, and cervical. Temporal, zygomatic, buccal, marginal mandibular, and cervical. So here you can see the main thing. This is in the parotid gland. After in the parotid gland, it divides into 1, 2, 3, 4, 5 branches. Okay. Before coming to the parotid gland, in the facial canal, in the canal, they give another three branch. Those three branches are C, N, G. C is for chorda tympani, N for naphtostapedius in the inner ear, and G for greater uh, petrosal nerve. Okay. So here you can see this is facial nerve. Chorda tympani. Chorda tympani, they are giving supply in the tongue. Auriculotemporal nerve. This is trigeminal nerve and their ganglion. So trigeminal nerve V1, V2, V3. V1 we know. This is V1 is which one? Ophthalmic, maxillary, and this is mandibular. From the mandibular, one branch coming and giving supply in the anterior tubercle. Remember we said anterior uh, 5V3. Yeah, 5V3. So this will be V3. Vagus nerve. Vagus is the boss nerve. They develop from fourth and sixth pharyngeal pouches. Vagus develop from fourth and sixth pharyngeal pouches. Just remember one thing. Vagus nerve. In the left side, vagus nerve has two, right and left. In the left side, here you can see left side, they come like this, descend like this. In the left side, they come like this, and if this is arch of the aorta, they come and they pierces, and again they go up. Here, left vagus. Right vagus. This is again radius abdomen, recurrent laryngeal nerve. This is very, very important. Inferior vagal ganglion, superior laryngeal nerve. Okay, this is vagus nerve, right vagus nerve. Okay, vagus nerve. So vagus nerve, it is coming down, 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 along with which one? Carotid. You remember in the carotid sheath there was vagus nerve, carotid artery, and internal jugular vein. So vagus nerve coming down, down in the right side from inferior vagal. This is inferior vagal ganglion. From inferior vagal ganglion, we have vagus nerve. Also, we have superior laryngeal nerve, not artery. So one is superior laryngeal nerve, another one is vagus nerve. Vagus nerve coming down, going along with carotid, the carotid sheath. In the right side, when it is coming at this level, it is making an arch and again going up. And its name is the right recurrent laryngeal nerve. In the right side, it is just this is subclavian. It is encircling at this level, subclavian level. But in the left side, it is coming down, down, down in the arch of aorta, and then it is going up. So here, its level is here, and its level is here. Sometimes you will get a question. There is a stab injury in the left side of the chest, and it injured blood vessel. Surgeon suspecting there is injury in the recurrent laryngeal nerve. Which of the following recurrent laryngeal nerve will not be injured? So if penetrating injury come at this level, injury definitely it will not go in the right side, because right side it is in the subclavian. Yes, right side in the subclavian at this level, subclavian level. But in the left side it is in here, manubrium span. Other option will yeah, they will say both recurrent laryngeal. They will say none of. Answer cervical is important. Answer cervical is their root value is cervical 1, 2, 3, and they give supply to the stap muscle. Stap muscle we have sternohyoid, omohyoid, and they give supply from the lower side, lower inferior aspect. That's why when we give any incision, we should give incision in the upper margin to avoid injury. Okay. So answer cervical is branches of cervical 1 anterior to the superior root C1, inferior root C2 and C3 innervation, sternothyroid, and omohyoid. Answer cervical lies in the anterior to the carotid sheath in the anterior triangle. Therefore, when dividing muscle, muscle should be divided in its upper half. This is the important thing. Here anatomy, not that. Tactile system, blood supply and innervation. If you want, you can read, but I didn't study it properly. Tonsil. Not that. Finish. Yeah. Second stage. Don't forget about the tongue nerve supply, thyroid blood supply.